Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.
Hi, I'm Sharrie Harlan, program host for Let's Talk Together. And today we are discussing heart health awareness. And our guest today is Erika Millsaps with Reid Health, and she is our manager of clinical education. And welcome, Erika.
Thank you. Thank you so much for having me.
And as we do all our guests, tell us a little about how you came to Reid and why you're in the profession.
Yes, of course. So I'm a nurse of background. I'm currently the manager of nursing education, or a manager of clinical education, as I like to call it. But my background, I actually started at the hospital about 11 years ago. I was a student nurse technician. I was actually going to school at Indiana University East, so right here in Richmond, and then did my clinicals at Reid. So started working at Reid, and it was a really wonderful experience. Worked in progressive care, worked as a stroke nurse, and I'm still a stroke certified nurse for about 5 years. I worked in that role and then transitioned to nursing education, which is really, I love being a nurse, but I also love education, which is kind of why I get to be here today.
Well, great. And I had the opportunity to work with Erika previously in her role as the stroke nurse. And she has helped us a lot in educating people about stroke in the community. So, and she still is now with Heart Health Awareness. So
Yes.
thank you, Erika.
Thank you.
And as we discuss heart health, what's some of the biggest things that we like to talk about? Like, how can we protect your heart?
Yes, for sure. So today I hope that we can go over some routine screenings as well as prevention. So we want to aim for prevention so that you can get ahead of it before it gets ahead of you. And then the goal would be then also knowing what signs and symptoms look like. So if there are warning signs, so maybe you already have heart disease, if you're in an urgent situation, what you're going to do about that. So hopefully we can kind of get through those main points so that you can you or everyone else that's listening can protect them.
And I believe some of the challenges are often when people think of heart health, they wait
Yes.
until they're in a crisis.
Yes, for sure.
And so what we're trying to teach them is not to wait. And if we are reviewing this constantly,
Yeah.
then we don't have to wait.
For sure.
On
It's unfortunate because cardiovascular disease, unfortunately, is still the leading cause of death in the United States for both males and females. So it is a very real problem. And I think that hopefully we can shed some light on what they can do in their daily practice, really just to modify their risk factors and then aim at prevention. So I definitely hope we can discuss that.
And so what is cardiovascular disease?
That's a good question. Always starting with the basics. So cardiovascular disease, that involves your heart, but it also involves your blood vessels. And so when we're talking about this, we want the health of those things. And a lot of things come together, to make you healthy, and I guess from a heart perspective. And so our aim, when we're looking at that, what happens a lot of times is the blood vessel plaque builds up or fat builds up. And sometimes that's related to our diet, exercise, sometimes just predisposed because of our genetics. And so when we're looking at cardiovascular disease, we're generally looking at the vessels, specifically in the heart, and how well they're functioning and if plaque has built up on those. So we can address like the different risk factors that cause cardiovascular disease.
Now, I'm seeing that with the American Heart Association, that they talk about the essential 8.
Yes. So I think that that is a priority thing. It's really all encompassing. They do a really great job of showing it as a wheel. And basically what we're looking at are different factors that contribute to your overall cardiac health. So some of the things that we can do, we can sleep. We can sleep a good 8 hours a night so that we can be well rested, because that also reduces stress on our body. Also, we look at lifestyle pieces. So we're going to talk about exercise, how much exercise you should have, eating a healthy diet. We'll look at what pieces of your diet should be modified to have the best overall health. We also have these risk factors. So we have blood pressure, cholesterol, diabetes. All of those things come together to help us to determine your overall cardiac health. So that's kind of what the wheel consists of.
Okay. And then our blood sugar.
Oh,
as well.
Yes, for sure.
So tell us about like screening and early detection.
Yes. So screenings are all about prevention. So if we all, just as a community, just as a group of people, we look more at preventing. You do this through screening. So you do this by going to your primary care provider and making sure that if at your age, you should have these certain things either annually, which means every year, or maybe it's every 5 years that you're doing those things for prevention purposes. And so early identification matters because sometimes, yes, genetically we're going to be predisposed because of who our mom or dad was, but it's also true that we can get ahead of it. So even if my mom is diabetic, it doesn't mean that I have to necessarily be diabetic. I can change my lifestyle early. And so by going to your annual wellness screening, we can screen for diabetes, high cholesterol, high blood pressure, even weight, just to see, are you trending up? Are you trending down? Some of us, I know, the pants, they fit how they fit. And so you can kind of get a feeling for that. But at the same time, those are our priorities when we're trying to screen.
And that's one of the challenges is getting people to the screenings because often people wait. And by that time, you start to have many more comorbidities. So
For sure. I think that one of the things as a bedside team member for nursing, one thing that I saw a lot, especially when I cared for stroke patients, is that they would come into the hospital at maybe 70 or 80 and they'll be like, I'm healthy as a horse, I don't have any health conditions. And then when we do the screening, so we test their cholesterol, we test their hemoglobin A1C, which is for diabetes. And we're like, actually, you do. You have high cholesterol, you have diabetes, you have high blood pressure. But because they didn't go to routine screenings, they didn't have a primary care provider, they didn't know they had those risks.
Oh, right.
So they didn't manage them.
One of the challenges that I've been able to see are, especially with men, that often we'll have like a 40, 50-year-old person, and they said, now, when's the last time you had a physical? And they said, when I was playing ball in high school.
Yeah.
And so
it definitely, a lot can happen in that time. And
correct.
Our diets, as Americans, unfortunately, we are always on the go. We are so fast paced. And so sometimes the things that we put in our body are not exactly nourishing. And so for that reason, I think, time gets ahead of us and a lot has changed even from 20 years ago, 10 years ago, even in what we eat. So
we had a situation, we did an outreach event and it was a lot of men. And we actually went to barbershops.
Oh, yeah.
And I took blood pressure or cholesterol. And then we had to call the ambulance because there were some people that they were just a walking time bomb.
Yes.
And
yeah, they didn't know their risk.
They did not know their risk. And then one group was like, well, we were going to do it. We were playing ball and our friend died. And I said, that didn't scare you?
Yeah.
So often just people put that off. So also, let's talk about blood pressure.
Yes. So blood pressure, it's a fundamental component just of our overall health in general. It impacts so many things. So if your blood pressure goes up over time, it just puts stress on all your vital organs. Also, high blood pressure, there's significant, risk. It can increase your risk of hemorrhagic stroke and or ischemic stroke, as well as just heart disease in general. So those are like big things. But what I have realized the most in educating individuals is that they don't actually realize what the numbers look like to be considered high blood pressure. So the American Heart Association, they provide a really good tool of demonstrating based on like color. Green, of course, means you're good, but then yellow, you're at risk. Red, oops, you already have high blood pressure. You probably need medication. And so what I've realized is a goal blood pressure is the top number should be less than 120, which is our systolic, and the diastolic, which is the bottom number, should be less than 80. And what I have found so often is individual will be like, well, it's not that bad. It's not that bad. My blood pressure is 130 over 90. And you're like, you're already predisposed and you're already at risk here. You maybe should already be on meds or at least trying lifestyle modification. And then by the time we're at the 140 mark, that's too high. Like we need to intervene with something. You truly have high blood pressure. And so So often I think we just don't understand what those numbers mean. And it's your healthcare provider's opportunity. Your PCP should be sharing that information. And if you don't go every year, they can't do that for you.
Right. And often that when you're saying that, I know I've went before, hadn't taken my medicine and say, "Oh, how do they know it's so high?"
Yes.
And I knew that I hadn't taken the medicine.
Yes.
So
For sure. And that's what there are lifestyle modifications. So if you get ahead of it early enough, it could mean that you don't have to take medicine. So you could, if you eat a low sodium diet, that is a great way to decrease your blood pressure. Just eating a balanced meal plan. So fruits, vegetables, low fat dairy, lean meats, all of those things contribute and can help with just overall health, but decreasing blood pressure.
another thing are cholesterol screenings.
Yes. So cholesterol is another thing. So there's pieces to cholesterol. There's good cholesterol and bad cholesterol. What we really want to avoid, like things that are high in saturated fats. So your potato chips, your McDonald's, those things, they're just not good for us. They don't have very much nutritional value. And what happens is that fat can't be processed naturally in the body. And so what happens then, it sticks to the vessel walls. And over time, when we're talking about cardiovascular risk or the vessels in your heart, your brain, and your body, those blood vessels become more and more narrow. And so then what can happen over time is they can become completely occluded because of that high cholesterol. And then the blood can't get through there, which is what causes a heart attack or a stroke.
And so when you're saying good and bad cholesterol,
Yes.
and often the places that you mentioned, what can people do as they're trying to get a better diet? Because often those things that are high in fats, they're on the dollar menu.
Yep. Exactly. I think it is. You have to find like a cost-effective approach, but also what you have access to. I think that is the truth completely. I think that even myself, I sometimes work more hours than I even can think in a day. And so then by the time it's time for mealtime, I could rush. So one of my best pieces of advice that was ever shared with me was planning. So I know that takes time too, meal prepping, but there are alternatives. There are different grocery stores that do have opportunities that are it's more affordable. And I utilize those to make healthy meals for my family. But I think that it's just being mindful of what you eat. Sometimes it's small substitutes. So it's choosing to replace something that is higher in sugar for something less. So while maybe pop soda is probably not great for anyone in general with what's in it. But sometimes if you're a diabetic, you really like the taste of that Coke, but maybe you need a Diet Coke, and maybe it's enough of still you enjoy it enough that it's a replacement for that, but that is a significant less amount of sugar. So
Now, what about the sodium?
yes, so sodium, you have to consider all of that, especially everything. So as a society, we preserve things with salt. So we don't even realize. I think that one of the most practical things that was ever taught to me is you think you're eating something super healthy because you're having canned green beans, but unfortunately they're packaged with salt. And so they already have a higher sodium content, which while a green bean is good for you, it still can increase your blood pressure. And so a practical thing is rinsing the green beans from the can. So taking them out, putting them in a colander, rinsing them, and then boiling them on the stove. So there are practical things, and the American Heart Association, really are amazing. They provide so many resources online that are completely free to us. I use them all the time in education of patients and their family to give you those practical strategies because sometimes it's not sustainable if you try to just like take everything and try to change it. But little changes can definitely make a meaningful impact.
And that's definitely, in this time of year, at the beginning of the year when people are coming with New Year's resolutions, and then they sweep the house, and then they slowly bring the things back in.
It's a great way to put it.
So much.
It's like out with the old and in with the new, but then sometimes it is really hard. And I think I think that it takes like roughly 21 days to create a true like habit.
Right.
And so it takes time to do those things. And so you really have to be mindful and you have to be dedicated to that transition, and then it becomes more natural.
And so with weight and obesity.
Yes. So that's always, a sensitive topic for anyone. I don't think that even when we go to our primary care provider, they're not like, hey, you're looking a little larger than you were before. Like, they don't say it like that. And no one should, because we're very sensitive about that. But I think it is important to know what your ideal weight should be. And I think so much we don't focus on that because people like to steer around it in appearances. But according to the American Heart Association, a BMI of 25 is ideal. So we measure that based on someone's height and then how much they weigh, and then it should be less than 25 ideally. So definitely that diet, exercise, those are ways that you can modify your weight.
Since we're on modification, so lifestyle modification is usually the best thing.
It really is. Like, there are so many things that you can think about. So smoking cessation or stopping smoking. If you smoke, not good. That's something you yourself could modify about your lifestyle. We also talk alcohol consumption. That is something we can modify. So I think that's another sensitive topic, but I think that moderation is key for that, because a lot of individuals do not realize how high sugar content is in alcoholic beverages, and for that reason alone, it can be risky, not to mention all of the other factors that come into play. And then we have diet modification. The American Heart Association provides some recommendations. The DASH diet, which is low in sodium, that's cardiac health, high in fruit, vegetables, like I mentioned, plant-based items, and then lean meats, so non-fatty meats. Mediterranean diet.
Explain that to me, because for some reason I must have said the wrong thing, because my timeline on social media has a lot of Mediterranean.
Yeah, and to be honest, I'm not as familiar, but it definitely is more plant-based and fruits and vegetables. So it's a natural sourcing focused rather than prepackaged items is really the goal, is substituting those things. I think we're here in Indiana, we're blessed that we can, if you have any amount of property, you can even have a small garden. So we have the opportunity to do that with our kids. And honestly, I think it's a very wholesome, nurturing activity just for them, but also we get to be blessed with that produce throughout the, summer months, and stock it up. Some people can, can it and different things. And it's just like a blessing, and also nourishes you. Yeah. So it's considerations. You can do it in small doses. You don't have to completely be a homesteader and switch your whole life.
But I have to add in just a quick plug for my other team members that if at the farmer's market, we have double bucks. And so we will work with people if they have like a EBT card or whatever, and they double the amount of items they can receive.
That's amazing.
For fruit and vegetables, and actually, it helps both. It helps the individuals, and it's also helping the farmers.
Yes.
Because then they tend to put together packages so those people can get, it stretches their budget.
For sure. And it tastes, and to me, it tastes so much better. There is nothing better than a fresh tomato. I just absolutely, that is my thing. And I know not everybody loves tomatoes, but there is, like, when you can enjoy those little pieces of life. So
mine is corn.
Yeah, fresh corn is good too.
Fresh corn.
We're good in Indiana. We have that for sure.
The looking at the role of the primary care physician.
Yes. So we touched on that just a little, but really it's important. It's important for you to establish yourself with care and find a primary care provider. And it's essential to long-term management. So one, we can identify your risk early on. We can do the screenings. A lot of healthcare programs, actually, it's a fundamental component. Like, to get a discount on your insurance, you have to do the screening. So it's helpful to go and do those things, whether it's fun or not. But doing that, you'll know your risk, and then we could put you on medication, or we could discuss diet and lifestyle modification.
And then they have more on their timeline. They could say, last year you were here, and now you're here. So how can we, what can we need to do to improve or keep up the good work?
For sure.
Looking at monitoring.
Yes, for sure.
So what's some signs of heart disease and a heart attack?
Yes. So our goal, obviously, we've talked a lot about prevention. We want to use screenings, but there's going to come a time where the screening we did our best and all those things, but people still have heart attacks. We haven't been able to completely prevent it. So you need to know the warning signs. The major warning signs are just definitely, chest discomfort, crushing chest pain. Sometimes, though, for women specifically, it's not as significant. It doesn't feel like there's an elephant on your chest. Women sometimes have radiating pain. So sometimes it goes down their arms, sometimes to their jaw or their back. Females often tend to have nausea and vomiting. All individuals like sweating, clamminess, lightheaded. Sometimes they can feel palpitations with that chest pain. So all of those things, if it's a sudden onset and all of a sudden it comes upon you and you're like, I don't feel right, and you have those signs and symptoms, and maybe you have some of these risks because you've done screening, you need to go to the emergency department. But not just that, like, you need to call 911. And I think that's the step so much that we miss. We're just like, I'm independent, I can handle this.
Right.
But you would never want to harm someone else. If you truly were having a heart attack, harm someone else because you're driving and then cause an accident or any of those things. Our first responders are amazing, and they're going to come and they're going to help you, and they can give you medicine now, instead of waiting that extra 5-10 minutes to go to the emergency department.
And with the, a lot of it, I think it's pride.
Yeah, I know it is. And it's such a thing, but I'm like, you want to be alive, right? Like in most cases. So I think that's the thing, is that I've had family members too that are like, well, I don't want to make a big deal. I don't know if that's really what's happening. A lot of times indigestion, can be mistaken, or vice versa. And so, but we have ways to rule that out. So if you come to the emergency department, we're going to strap you to a telemetry monitor. We're going to run an EKG, and we're going to tell you if you're having a heart attack or not. And we're going to do some lab values. And if you're not having a heart attack, we're still going to treat your symptoms. So, we don't want you to be in pain. We don't want you to have those things. So I would just encourage, it's easier said than done, but go,
I like to say often people will let $100 problem become a $100,000 problem.
That is a good way to put it. Yep. It could become so much bigger if you don't intervene early. For sure.
And often, that's usually my motto during screenings.
Mm-hmm.
And if I have a really rough person,
yeah,
it's often like, you don't understand, you can come see me, or you might be seen in the corridor.
Yeah. And that's not what any of us want, right?
No.
I went into our line of work to help people.
Right.
Save,
I'm not trying to scare you.
No.
But
for sure.
But that's some of the challenges.
Mm-hmm.
So we've talked about just protecting your heart with screenings and the risk factors, and just knowing symptoms.
Yes, for sure. I think that the priority thing that I just want to share is, your life matters. Heart health matters. That's why we're here talking about this today. And there are small changes. There are small steps that could make a very big, meaningful impact on your life. And that is really, I think that's my passion, is providing the education and the resources. I meet so many people that are like, I never knew that. I've never heard that. And so that is really, I feel blessed to be able to sometimes share that information with individuals. So hopefully there's just one tidbit that somebody can take and apply it to their life, and maybe it can make a meaningful impact.
And you have no idea how people remember the things you share with them.
Sure. Yep. It could. You never know. You never know what impact you have on people.
I have people tell me all the time, no, I learned that at a community education event. Don't you know you should only do such and such? I'm like, oh, wow.
Yes.
Okay.
Yes.
So that makes our be back moment, makes us be ready to come back the next day to educate people. What are some other things that you'd like people to know?
Oh, goodness. Does it have to be about heart health? There's so many things I could share now. No, Sharrie knows that my passion definitely is in stroke. And I think that my only other plug is that it works in conjunction. So everything that you do for your heart, it can impact your brain too. The same thing. Blood vessels, they can build up with plaque, and it can cause a stroke just like it does a heart attack. So I think that's really the emphasis, is that a heart attack is bad, but a lot of people live through a heart attack. They can walk out of a hospital. Some don't, and we know that. But stroke, you generally don't walk out the same way that you went in. And I think that is the thing too, that like it's one of the leading causes of death, but it's also is the leading cause of disability. And I'm not sure if there's one that, that's worse than the other, but I just think taking control of your health, going to your primary care provider, it's one day, hopefully, just one day, for maybe an hour or 30 minutes, to follow up on what medications that you're on or screenings that you need. It literally could save your life. And I think we want to spend time with our loved ones, right? We want that. So
On that note, that's probably a big thing to encourage people to say, well, I want to see my children and my grandchildren, what they're doing in their sports or
Yes.
going to school. So often that's an incentive
yes,
for people to,
take care of themselves.
Yes.
Yeah, make themselves a priority. I think sometimes we sometimes sacrifice. Some individuals are very sacrificial, and they don't make mention of the tiny little bit of pain that they had or those pieces. And so sometimes it is a big deal. It's worth mentioning. It's worth following up on.
or when people say, oh, it's just, I think the difference is when they think it's just a little something,
Oh, yes. Yes.
but that's something that's just tapping on the door.
Yeah, it's a warning sign. It's a warning sign that something worse could be coming. And you don't ever want to live your life in fear. I would never encourage that. But awareness is important. For sure.
And once again, we can't stress how much just so minor changes
Yes.
can really.
For sure. Yeah, just small things. I think that all the time there's differences like processed things versus not processed things. But just like really actually just looking at your plate and seeing how much of any type of item that you have. If you have a whole, half your plate is potato chips,
Right.
the other is a hamburger on a big old bun with some mayonnaise and ketchup. And we don't realize even how many calories and how much sugar is in condiments. We just don't even consider it. We don't process it sometimes. And then I went to Starbucks and I grabbed my big old coffee that had lots of sugar. And then I went down the street, and you just don't think before, it's ahead of you before you even know it. So it's just the little things, just cutting back on them. It can make a meaningful impact.
Oh, great. And on that note, Erika, I can't thank you enough for joining us today. And thank you for joining us on Let's Talk Together.